so long ago, we had more than 22 million new jobs. That was 10 years ago. And you know, we also lifted more people out of poverty at the same time. I am committed to getting people out of poverty, and that's what we were doing. We lifted millions and millions of people out of poverty because they had a job. They had a future. They felt like they were on the track to the American dream, and under President Bush, 5 million people have fallen back into poverty. That's not the direction America needs to be going. We want people working and being productive. And I do not believe anyone who works full-time should be in poverty. If you're a full-time worker in the economy, and here's how we do that. You know, we have more jobs created. We get back to fiscal responsibility, something that was totally disregarded when George Bush became president. He inherited a balanced budget and a surplus, and proceeded to squander it all in two predominant ways. If you make more than $250,000, there may be somebody here who does. If you make more than $250,000, you should write a thank you note to President Bush. Because you've been given tax cuts and tax cuts, none of which have been paid for. And he was the first president ever to take us to war and refuse to pay for it. So people ask me all the time, where did that balanced budget and surplus go? Well, it went to Iraq, and it went to tax cuts for the wealthiest of Americans. So we're going to end the war in Iraq, and we're going to bring that money home and put it to work right here in Mississippi and across America. And I'll tell you what else we're going to do. We are finally going to have a healthcare system that works for everybody, that offers quality, affordable health care for everybody. People ask me all the time, how can we do that? Well, we already spend more money on health care than anybody in the world by about 50%. And we don't cover everybody. We have 47 million people without health insurance, and we have millions more who have insurance okay, but it's kind of like your flood insurance. You know? I mean, you have insurance, the insurance company comes and says, well, we think your damage was from wind. I said, well, we're covered for wind. Oh no, we meant it's from flood. That's what health insurance companies do. Health insurance companies are making life and death decisions, not doctors and nurses. And the net result is, people who pay their insurance premiums are shocked when all of a sudden the insurance company says no to their doctor or no to their hospital. I want to ask you, how many of you know somebody who doesn't have health insurance? How about everybody outside? Anybody know anybody who doesn't have health insurance? And how many of you, maybe you yourself, have argued with an insurance company to get it to pay for what your doctor in the hospital says you need? You see, we got two problems, not just one. We've got the problem of the uninsured who show up in the emergency room, and every time they get taken care of, which thank goodness they do in America, that bill gets passed on to everybody else. And we got the problem of the people who have insurance, but it's not worth the paper it's written on. So here's what I want to do. If you have health insurance and you're happy with it, nothing changes. You keep what you have. If you don't have insurance, or you have insurance but it doesn't cover what you need it for, say you're a diabetic and they won't cover your diabetes, or say you have a heart condition and they won't cover that, we're going to give you the choice of going into the same plan that insures members of Congress. See, Congress has a good plan for itself and for federal employees. Over 250 options, and these are all private health insurance options. This is not government run. This is not socialized medicine. These are private insurance options that members of Congress and federal employees get to choose from. And the cost is less than what you can afford because there are millions and millions of people in the system, and you get the cost down. If you go to a discount store, you buy a carton of toilet paper, it costs you less than if you buy one at a time, right? So if you've got millions of people, it's like being in a big, giant healthcare discount store. You get the benefits of so many more people because they have more volume, so you get a lower price. And so when we open this up, people will be able to afford the lower price if they have a problem affording it, and there will be many who do. We're going to give tax credits, and I'm also going to limit the amount of money that anybody has to pay as a percentage of your income for your health insurance. So we start getting everybody in the system. That will help us actually lower costs, because there won't be any more hidden tax. Do you know how much you pay because we have all these uninsured people? On average, $900 a year you pay, because we have all these uninsured people. So once everybody has to pay something, you see, you no longer have to pay that hidden tax, and your premiums can go down. So this is the kind of plan that I think makes a lot of sense. It's uniquely American. It is what Congress already has. I'm waiting for the Republicans to complain about it, and I'm going to ask all the Republican members of Congress, well, how can you complain about giving to your constituents what you have for yourself? Because after all, they pay for it. They pay for your health care, 75% of it. Now, this is a big difference between me and Senator Obama, because his plan doesn't cover everybody. He made a different choice. But my plan does, and I'll tell you why. Because if we don't cover everybody, the insurance companies are still going to call the shots. They're still going to be able to put that hidden tax on each and every one of us. We're not going to be able to get everybody in to get prevention, and we sure do need to do that, because you know what happens now. People don't get the tests. They don't find out whether they got the cancer early. They show up too late, and it's expensive to take care of them. But it's not only what we should do, it's what we must do. You see, there's a moral reason to do this. I've been involved in healthcare for a long time, and I have met too many people. Maybe you know somebody who has literally lost a loved one because the insurance company wouldn't pay for what was needed, or because they were uninsured, they didn't get care until it was too late. So this is the morally right thing to do, and it is the economically smart thing for our country to do. So I'm going to be committed to working to get us quality, affordable health care that includes prevention and includes mental health coverage.